When I finally was having the contractions for like 2 days straight, I went to access. I got there at 7 and I had her at 8:30. I had to push her out and she was so tiny. She was beautiful, but she was tiny.
Throughout the pregnancy, I noticed that we were having problems. When I was like 5 months, I was already dilating like I was with her. And then 6 months came and I missed that appointment. And then the 7th month came and that's when we found out that I was carrying him already, past.
Infant mortality is the rate that we count for babies that are born, live, and then die before their first birthday.
80% of all infant deaths are to extremely premature babies that are born and go directly into the newborn intensive care unit at the hospital where they're born and never leave.
50% of those babies die on the first day of life. 85% of them die before they ever leave the hospital, which means they're born really little, really early, or really sick. And that prompts us to look at the health of the pregnancy or the health and well-being of mom before she ever got pregnant to try to figure out what happened.
You are the best incubator in the whole world. No piece of machinery can ever take the place of this incubator.
Babies born to black women die more frequently than babies born to white women.
We've always seen a disparity among ethnic groups, and especially with the African American population.
There is essentially 3 times greater risk of African American child dying during the first year of life compared to whites.
So this has really been a very consistent, very dramatic, and very worrisome finding in the United States.
In Wisconsin, we've had the sad national disgrace of having among the worst African American birth outcomes in the nation, worse than Alabama, Mississippi, Louisiana.
As a practitioner, it's been really troubling to see big differences in the rates between whites and blacks across the board in terms of chronic disease and birth outcomes.
This has been our biggest public health problem in obstetrics throughout the whole country. And it's an issue that a lot of really smart people are trying to figure out.
If we have the greatest health care, we have facilities available, where you have insurance or not insurance, there's still someone around who'll say, I can help you or figure a way how to do it. So why are we still having this rate of infant mortality?
I still do not believe that no matter how I come to you, that I'm going to get equal services as a white woman that is maybe at the same educational status.
I'm teaching my 10-year-old about racism and white people. Okay, and that same 10-year-old white child over there, where is that child being taught? So now so they're gonna clash. One is a doctor, one is a patient. There's gonna be some clashing going on.
When I first moved up here, it was the first time I actually had experienced being prejudiced towards me out front.
Until I was in 6th grade, I lived on the north side of Madison. Never thought about my race, never ever did. Moved to some prairie, then the questions started coming by. Why does your hair look like that? How come you're hanging out with those white kids?
Your race was a big factor, and they let you know it. When you go, you hear a lot of prejudiced things being said.
Why do you talk like that? Why do you dress that way? And I'm like, what is a white way to dress? What is a black way to talk? What are you talking about?
Everyone's gonna fit in one category. When you're young and black, then you've got to be wild or coming from a tough home. So everything's got to, stereotyped.
It's a big deal for people to acknowledge that we do get married, we do have families, and I think depending on where you stay at, they would just assume that this will be my baby daddy and not my husband.
I think stereotype is a big problem. A lot of people just assume by looking at you that you've got to be one way.
We've been together for 10 years, and you could say like 8 or 9 of that we've been trying to get pregnant. And I've been to fertility clinics. I had one doctor tell me, there's nothing I can do for you, we're not gonna treat you. He automatically told me I had a sexually transmitted disease and that's why I wasn't getting pregnant. Automatically off the top. So then when we move here, I go to the doctor, they're like, oh, you have polycystic ovaries.
Dane County, in the last 5 years, we saw a big reduction.
We had arrived at a point in Dane County where black infant mortality was essentially the same as white infant mortality.
There's a big difference in Madison area between the infant mortality rate and other areas in Wisconsin and across the states.
It was about a year ago that we discovered this change, this really great improvement, and we didn't know why. Our first thought was to go to clinical practice and to ask if anything had changed.
I am having trouble coming up with a single medical intervention that has changed since 2001 or in the last 10 years or so, or any intervention that we specifically in Dane County are doing that's not being done in the rest of the country.
We find that there are many fewer premature babies being born to African American women than there were before, and those are the babies that most often die.
Babies are being born bigger. So a 28-week baby now is heavier than a 28-week baby was 10 years ago, and they're being born later. Prematurity has improved, so babies are being born more often than not after 32 weeks instead of before, and their survival rate is better.
We're trying to figure out, what did we do right, in essence, that the babies, the percentage of African American babies decreased in their death rate while in else 5 years.
It could be a difference between one generation to the next. It might be a difference between here, this place, Madison and Dane County, and other places in the country or the state. And the best way to learn about that is to go to the community itself and ask questions and listen hard.
First, I just want to say I appreciate us having an opportunity to have this discussion and actually be a part of a process that is positive. Oftentimes when we go to the doctors, they tell us all the negative things or all the risks that we're, a part of. So I appreciate participating in something that, is good for all. And what I can say is that through the health insurance with my job, there was an emphasis on all preventive care. So I felt that there was a system in place right away around the pregnancy for wellness.
I work for Access Community Health Clinic, and what I've seen change in Dane County since I've been here, which has been like 33 years or so, and in 2002, Access Community Health Center became a federally funded clinic, and that has made a great difference in the lives of people here in Dane County who can't afford, who's either undocumented or just can't afford health insurance. And that has been a great change I've seen.
Dane County is a pretty progressive community. You have politicians, you have professionals, paraprofessionals, people in the trenches committed to working to make communities better. It's easy to say all babies should be healthy. It's much harder to roll up your sleeves and do the work.
There never has been enough attention and accolades given to the people who created and built that collaboration, because it made a difference in this community, and it's still making a difference.
I believe that healthcare has a lot to do with it. I think the fact that you don't have to, decide, should I feed my baby or should I take her to the doctor, to, whichever one you have to do. I think that, and the fact that the healthcare covers so much, and not just here, a couple shots there, it covers a lot. And I think that hands down has a lot to do with it. Because if your baby's sick, you don't have to say, well, I would take it to the doctor, but I can't because I can't afford it. You can just go and get it done, and your baby can be taken care of that way.
So we're going to listen here. I don't think there's any difference in the quality of care that an African American woman receives, or a Hispanic woman, or a Hmong lady, or a young, poor white woman. I think they're all getting very good care. And you have a pediatrician. Mm-hmm. Who's Raquan's pediatrician?
Dane County is a wealth of resources, for one thing. We have a lot of people here that really care.
There's so many people in Madison who, care about the upbringing of children that want to help you.
All I'm doing is prenatal care coordination. If anything comes up, you have the phone number, you can give us a call anytime. I don't have to balance my workload, it's just totally devoted to my moms and babies.
Both public health departments, before they were merged, city in Dane County, that they were doing a really great job in terms of engaging with pregnant women.
I think home visiting is essential.
Huge.
Essential.
Yeah.
We're going to see Dominique and her beautiful baby to see how things are going with him today, and her in the breastfeeding, to see if he's growing, he's gaining weight, and seeing the physician as he's being directed and up to date on his immunizations.
When I go into a home, I say my goal with you is so we can work together so you can have a healthy baby.
Good morning. Oh, look at him. Hi, good morning, Peyton. Good morning, Dominique.
The connection. The connection with someone that cares that they're going to have a healthy baby.
That's great. So he's got a good relationship with your mom, too. That's so important. It really is.
We provide a vast array of services, I feel, starting out with assessment to assess what types of social health issues are going on within that family.
12-11 today.
13 pounds. He's a big boy. All that good breast milk.
I'm excited.
The minute you walk through the door, you're looking at the whole family. How are the children relating to each other? How is the mother relating to the children? Always looking at the whole family.
It makes a difference when decision makers listen to citizens and listen to those people who are receiving the services.
I think it's a combination of health and social work. When you assess families' needs, you have to establish what the priorities are for that family and not what my priorities are, but what their priorities are.
You meet them where they are and you work with together. It's a team. It's not they're doing anything for you.
When I was in Indiana, you pretty much fend for yourself. No home nurse, no nothing like that. I didn't know how important it was to breastfeed. A lot of us didn't know, and no one encouraged us to do it. Here was completely different, which is why I'm still here.
And are you getting a little sleep?
No. My home health nurse is the one who informed me of all the ups for breastfeeding. So, and I tried it, and I think it was well.
More and more African American women nowadays are breastfeeding. There we go.
More and more women are actually breastfeeding their babies, providing the breast milk for the babies, whether they pump the milk or they put the baby to breast. More and more women are going back to work a lot sooner, and yet they're still trying to provide this milk.
When I started going to the doctor more after I had my baby, it was a lot of the doctors were shocked that I was breastfeeding. They're like, "That's very mature. That's the right thing to do." So it must have not been that common.
I think that the nurses in Dane County, once they do the assessment of things, know the resources and can establish what's going to work for this client.
Navigating the system often is a big barrier. And a nurse is pretty non-threatening. You walk through the door and a nurse is sort of known as a helper.
There's a real relationship to the community. We're all interested in better outcomes for these women. We're learning what the resources are. We're learning to diagnose and refer appropriately. So I know my whole life has been about taking care of women and babies.
Free?
Yeah.
Well, neither one of us have. Nurses coming out to your home, I really think that helped because the nurses are dedicated to the patient. I never received that kind of treatment, and I never heard of that kind of treatment until I came to Dane. My nurse, my in-home nurse, she helped a lot. She made a big improvement. I really didn't need any assistance until my pregnancy, and that's when I got all the help that I needed.
Mothers are more empowered, At one point, I think in hospitals, they felt like, don't ask the medical doctor, they know what they're doing. Now they're empowered. It's their right to ask a question and to get an answer.
If you call them and ask a question, they're really good about answering your question. They didn't make you feel like, I don't have time to talk to you.
Isn't it fun to be able to feed them?
Oh, yeah.
If you don't get the information for prenatal care, you don't want it. You know, they throw it out there, they put it out there for you, let you know it's there.
Automatically from the beginning, I was high risk because I've had 4 miscarriages before her. So they knew, okay, you're going to be a high risk pregnancy. This is how you need to handle things.
The doctor, Dr. Davison, she's the hospital specialist, and she was on it.
Hey, Dr. Hey, Cherise, how you doing?
She does not take anything for granted.
Everything going okay? Yeah. Good, good.
And that makes a big deal. I mean, even the slightest little thing, she's like, okay, we're going to run this test to make sure. And we're going to test this to make sure.
Yeah, and how are the blood sugars?
It's good.
Yeah, you know what? Let me find your chart and I'll take a look, okay?
Okay.
Maybe it's not something medical. Maybe it has to do with more community involvement, maybe more church involvement.
The African American Church makes a big push on making sure that their membership or families, extended families, are taken care of.
They are an organization that are trying to learn and to better have a understanding of healthier communities, not only for our spiritual growth, but also for our natural growth.
The change we kind of went through was everything was just focused on the spiritual aspect of life, and now we realize we have to minister to the whole person. You know, the social affects the spiritual affects the social. So it's the whole person. We got to make sure they have health care, make sure they have food, make sure they have a place to live, and all these things.
Trying to help them connect to needed supported services so they can move on a path to their goals and dreams and meet their needs.
I also want to get back into school. I want him to get back into school. I want a bigger house.
It's hard to concentrate on a healthy pregnancy or have a healthy pregnancy and not be stressed if you're worried about where you're going to live, where you're going to get food, how you're going to get transportation to your next appointment.
So there's a lot of things that have slowly been improving that actually impacts on the mother's health and her having a healthy baby.
I know from education and from everyone, a father is a very important role in a child's life, and that a child has a better chance with 2 parents than 1.
You're not gonna do my hair? Her having not just a mother to be around, you have a father also.
Even though we're not together, like even when I first found out I was pregnant, he's still extremely involved. Like he calls every night, he sees them and gets them like all the time, and he wants that close relationship, and it's really important for him to have that.
Yeah, don't let your baby go nowhere.
But I'm like, honey, we're pregnant. He said, what? And it just got silent for like 2 minutes, and I'm like, hello? And all of a sudden his throat got kind of clenchy or whiny, and then it sounded like he started crying. And then when I got home, he was excited. He ran to my stomach and he kissed my stomach, and he was like, you're pregnant. I'm like, we're pregnant. So we went out to Applebee's and celebrated. Congratulations, Tim.
Thanks.
It's our baby.
Perceptions and generations, they are changing. They shot in my house, with guns and stuff, okay, when I was a little girl. Now my kids, they didn't see any of that. They might not take to our values, She didn't take to it.
I tried to ignore all the bad things. I focused on the baby because I'm like, whatever I feel, he's gonna feel. So I changed my whole perspective and to just be happy.
Everybody passes judgments, and I think you just sometimes have to be the bigger person and just not make it such a big deal and try to work through it.
With the OB that saw me initially, because at 20 weeks my body was prepared to deliver the baby. She said, well, I frankly don't think you'll even make it to 23 weeks with this baby because your body's just prepared. And I said, well, I beg to differ, and I'm going to do the best that I can, and whatever it takes, we'll do. And she came to this world healthy, smarter than anything that I mean, she's just a number one.
We cannot sit on our laurels ever. We need to know why this is happening so that we, A, can continue to do it, B, maybe improve, and C, share whatever we're doing with the rest of the country so that we can all get to this level.
The temptation is to say, there, we fixed that, our rates are equal, and to really pat ourselves on the back and go forward.
We still have a lot of work to do.
I think in talking to women, I'm already starting to hear things that are still not fair or right or just.
A lot of people that I've talked to have moved here looking for something better. And when they've gotten here, they've been able to get access to some of those services that they've needed right away. I think the challenge comes at the next step. People are able to access, and so you're able to get in, but then that upward mobility is what becomes really challenging.
It's like in the middle, when you're in the middle, if you're not up here, then you don't get nothing, and if you're not down here, you don't get nothing. When you're in the middle, that's the toughest part, when you're trying to come up. And they're like, pull yourself up by your bootstraps, and then you're like, I don't have boots, okay? How? You know?
So there is so much community education that needs to happen to make sure that every woman who wants to have a child is ready to have a child, emotionally, physically, ideally economically. The economic point is probably the biggest challenge of the whole deal.
I thank you for you being very honest and forthright with the information that you shared with us today. So
I think what needs to be held on to is the importance of bringing people to the table and never leave anybody out, no matter who they are. It strengthens race relations, it strengthens families, it just makes the entire community stronger.
This is something that we can make a national impact. But also I think, you know, as a community we should celebrate that we've done something really good.